Many hospitals throughout the state facing a surge of COVID patients. What's being done for patients in the event of other emergencies? WDHN's Alex Valdez joins us now live in front of Flowers Hospital. Alex, how are hospitals dealing with non-COVID emergency situations?
Good evening, Amanda. As we all know, COVID hospitalizations are on the rise across the state. Well, today I spoke with Dr. Don Williamson with the Alabama Hospital Association, and he tells me it's becoming more and more difficult for hospital workers to keep up with the demand of COVID patients and also everyday emergencies as well. According to Williamson, COVID is negatively impacting the ability of frontline medical professionals to provide care for a number of emergencies. He says there have been plenty of patients transferred out of state because there weren't enough facilities available.
We're seeing the challenges associated now with COVID. It's getting very, very difficult, if not impossible, to arrange all the transfers that need to happen.
Dr. Williamson wants to remind the community emergencies such as heart attacks and car accidents still occur every single day, and every COVID hospitalization makes it more difficult to provide care to those patients.
The system is in great jeopardy of locking down and making transfers essentially impossible. Yesterday, we had negative 53 ICU beds.
Williamson fears the state is facing a real crisis that could become much worse if not enough people get vaccinated or start wearing a mask in the coming weeks.
Physicians are increasingly frustrated, and nurses too, and frankly angry. I mean, this didn't have to happen. We do not have to be here, but we have chosen to be here because enough people didn't get vaccinated.
Dr. Williamson tells me the only way to reverse this trend is if everybody goes out and gets vaccinated and wears a mask. He says that's the only way we can go back to being fully normal. For now, back to you in the studio, Amanda.